Okay, let's talk about tick removal. Now, first off, you don't want to try to smother the tick. You don't want to try to cover them with Vaseline or nail polish. You don't want to apply heat. I've heard about, putting a lit match or something really warm to them to try to get the tick to back out. All that does is irritate the tick and make the tick dig in deeper. Don't use your fingers. As you squeeze that body of that tick, as you try to grasp that tick to pull it out, oftentimes you're actually injecting things that are in the tick's mouth and gut into the skin in an attempt to pull the tick out. So the best thing to use is use a set of tweezers. You want to grasp the tick as close as possible to the surface of the skin and then apply steady, gentle pressure as you gradually pull and pull harder on that tick until it releases and comes out. Once it's out, then you're going to put a little antibiotic ointment, clean with some soap and water, and then put a little antibiotic ointment and watch it over the next couple of days, and it should heal just fine. The big question we always get is, well, what if I pull the tick and the head doesn't come out? And so you're left with those pieces still in the skin. Well, just clean that area with a little alcohol, take a clean sterile needle, and you can just pick those few little pieces of the head of the tick out of the skin. If you're unable to do this, there's no danger of leaving that there. It will cause a little bit of irritation, but just keep the area clean, watch it, and over the next several days, those mouth parts and head of the tick should gradually work its way out. So when do you bring your child in to have us take a look when your child has had a tick bite? First off, remember the vast majority of tick bites are harmless, okay? The vast majority of ticks do not carry disease. And there may be a little irritation at the side of the tick when you remove it, and that usually resolves in a day or two. They don't typically cause any pain or itch. If there is a little bit of itching, you can use just a little over-the-counter hydrocortisone cream. Put that on there about 3 times a day. That usually does the trick. But if your child does develop persistent fever and headache, or some joint complaints, or a rash around the site of the tick bite in those days to weeks after the tick bite, then call us. We'll need to take a look at them. If your child has these symptoms and you don't know of a tick bite, this time of year, it's worth bringing them into as well. Oftentimes people with some of these illnesses don't ever recall being bit by a tick. The tick has had its meal and fallen off before it was ever discovered. Okay, so here's the things to remember. You can prevent ticks by keeping your yard neat and cut frequently. Apply DEET 30%, not more than that, 30% to exposed skin areas. Kids younger than 3 years of age, you want to use something a lot lower strength. You're better off by just primarily using the permethrin, 0.5%. Apply that to the child's clothing. But all of us can apply that to our clothing in addition to the DEET. You want to do daily body checks, looking for tick bites. If you have pets that frequent outdoors, again, contact your vet and have them seen so they can be put on medication to ward off ticks. When you remove a tick, use tweezers. Use tweezers only. Previously, I did forget to mention if you do have tiny ticks, you can sometimes easily scrape that off with the edge of a credit card, so that would be acceptable. But wait a few minutes until you can get a pair of tweezers before you rush and pull a tick off with your fingers. And if the head breaks off, don't freak out. Call the office. If there's persistent redness or irritation at the site of the tick bite, pain, drainage, anything that would indicate some sort of local infection. Also, if your child develops persistent fever and headache, joint complaints, or a rash from around the side of the tick, in the days or weeks after the tick has been removed, we want to see those kids. Well, I hope I didn't scare everybody. It really is safe outdoors. Tick-borne diseases are relatively uncommon, and And when we catch them early, they're relatively easy to treat. Just remember these tips that I've given. You can certainly forward them to friends and family. But everybody have a safe and happy summer. And check back with us on Facebook for more tips later on. All right. Thanks a lot.